It was a young woman, went through menopause at age 38. It's called premature ovarian failure. It happens. She went to someone who I quote, "You're too young to be put on hormones. You'll start bleeding again and having periods." And I stood there literally with my mouth open, literally, and said, that is probably the stupidest thing I've ever heard. The answer should have been, you're too young not to have hormones. Her body should have been producing it. So that response was, one of my friends called it criminal.
Hello, possibility seekers. It's me, and I'm back with a phenomenal guest. Did you ever want to have a real conversation with your OB-GYN? Did you ever want to have a doctor that you can actually have a conversation with? Did you ever want to visit a doctor that spends more than 15 minutes with you and gives you some pat answer about what drug you should be taking? Where you know the drug rep just left the waiting room. Well, this is the guest that I have today. Today's guest is Dr. Cindy Parnes, a highly respected and compassionate physician who has been serving women in Bergen County for over 30 years. A magna cum laude, Tufts University graduate, and top of her class at Vanderbilt University Medical School, Dr. Parnes completed her residency at Mount Sinai Medical Center in New York, where she also served as chief resident. She is a board certified in OB-GYN and a fellow of the American College of Obstetrics and Gynecology. After years of practicing both obstetrics and gynecology, she founded the New Jersey Women's Wellness Center in Montvale, where she focuses exclusively on comprehensive gynecological care. Dr. Parnes is known for treating the whole patient, mind, body, and soul, and for always taking the time to truly listen. Welcome, Cindy Dr. Parnes. Thank you for coming.
Thank you for having me. I'm looking forward to our conversation.
Yeah, me too. This is fabulous. First of all, if I have another conversation with women about hormones, weight loss, my body doesn't feel like it's supposed to, my sex life is not what it's supposed to, I hear all of this and I'm like, I only do vitamins. I got to talk to Dr. Parnes. I don't know. So let's unpack this conversation, right? So tell us, first of all, your journey and how you became an OB-GYN to begin with.
You know, in medical school, you go through a variety of departments, and OB-GYN is extremely unique. There is actually no other specialty like it because you are both a primary, you are a surgeon, and you deliver babies. There's nothing that competes with that. You know, as a surgeon, you see the patient, you operate, you see him back, and you're done. Well, I just saw a patient this week who's been with me for 35 years. So you develop those relationships beyond having babies. Having babies, when it's good, there's nothing better. When it's bad, there's nothing worse. But, you know, so that was a unique part of it. Being able to do surgery was a unique part of it. And being a primary is a unique part of it. The longer you're in practice, the more your patients age with you, right? So the patient that I had for 35 years is no longer 30, right? She's 65. And so you develop different skills and you develop, what can I say? People come in with different complaints. And so you develop that knowledge base. And so after I did deliveries for about 20 years and then decided just to concentrate on GYN. And then I progressed into all that middle-aged stuff that people complain about.
And you find that fascinating because, to your point, you're aging with your patients. So you're bringing your knowledge base, your interests, your curiosity of the subject from a medical perspective to their doorstep.
Correct. So, for instance, for me, I was one of those people that went through menopause that was extremely symptomatic. And I see patients that come in symptomatic that have been to other docs, and their responses are ridiculous to these patients.
Tell us the kinds of responses that you've heard these.
I hate to say this. I probably heard the stupidest response ever from a patient this last week. It was a young woman. She was probably 41, but at age 38, And let me just say one thing, I'm not breaking HIPAA, and I already told her that she was gonna be the topic of conversation at dinner, okay? And she was fine with that. Uh, I literally told her that. So she went through menopause at age 38. It's called premature ovarian failure, it happens, right? Normal menopause is 45 to 55, that's, but a bell-shaped curve has tails at each end, and you have people much younger, and you have people at 60, you know? So at 38, and she went to someone who I quote, "You're too young to be put on hormones. You'll start bleeding again and having periods." And I stood there literally with my mouth open, literally, and said, "That is probably the stupidest thing I've ever heard." The answer should have been, "You're too young not to have hormones." Her body should have been producing it. So that response was, one of my friends called it criminal. I mean, it really, so you hear all kinds of things. And she's coming back to me soon, and she was so happy because she felt heard and she knew she was right in how she was feeling. But then you hear men say, "Oh, you just got to live through it," and other people say, "Oh, it's dangerous," and it isn't. I mean, Oprah just had a special on TV, and if Oprah says it's good, it's got to be good, right?
Yeah, no, listen, I didn't actually get a chance to watch it. I was hoping to get to watch it before we chatted, but the notion of being heard and seen is it seems, as I'm getting to know you and I'm talking to you, that's a very big theme for you. Hearing and seeing women as they are, who they are when they show up to your office. And I feel like you've acquired a lot of patients who have had quite the opposite experiences.
Right. Even with weight loss for hormone replacement, there, there's a lot of things. Sex is a big issue, middle age, and that's another whole topic.
No, we're gonna unpack some of that. I think we should unpack all the things that had you become an OB-GYN, and maybe they've evolved over the years.
They have evolved over the years.
So bring some of that to me right now. Tell me, like, how I know what you loved most about OB-GYN is it's the best and it could be the worst, but unpack that a little bit and tell me now your current state of your love for GYN.
As far as like delivering babies, I mean, my brother's a pediatrician. We are a family that loves kids. And so, yeah, so he and I are just on the other side of of your birthday, right? I used to say to him, I get all the questions for 9 months. He gets them for 18 years. But, it's wonderful. I'm having dinner this weekend with a friend who I became friends afterwards, but I delivered her son, you know, 35 years ago.
Aw.
And I've seen patients back that I delivered. When I first went into practice and I was with some older physicians and they'd see patients that they delivered, I'd say, "Oh, that's ridiculous. I'll be too old at that time." And here I am seeing a ton of patients that I had delivered. They leave me to go have their babies, and they should, right? So that's nice. I mean, that's wonderful. I can't tell you how it upsets me so when people are suffering and just don't get a simple solution, and it is a simple solution as far as hormones are concerned.
You're of the mind that if it's done properly and it's done thoughtfully, there is a hormone solution scenario that makes sense that's not harmful long term.
Okay, so there's really very little harm, period, okay? And the only risk over time may be breast cancer, but 1 in 8 American women are gonna get breast cancer regardless of hormone replacement. I used to say something to my mom about possibly having some hormones, and this is where individuality makes a difference, and ask me that in a minute. I'll tell this story, and then I'll tell you about individuality. And you have to learn this in practice, right? So my mother was terrified, right? So you can't give her hormones because even if she got breast cancer, she would second guess her choice, right? She'd have to live with the result, and she couldn't. So she never took any hormones, but at 81, she got breast cancer anyway, right? But that's not, we're all going to die from something. At 81, the breast cancer wasn't killing her. It's, a simple thing. All right. And people forget that with all the advancements we have, Stage 1 breast cancer is 98% curable. You have to be on top of the screening. You have to, I'm a stickler about that. If we're gonna find it, we're gonna find it early, and we're all gonna have something in this life. The question is, how much is it gonna affect you? Is it gonna be the death of you, or is it just gonna be a little bit of a hiccup along the road?
So for me, I'm gonna be totally frank. Before this conversation, before I met you, I was totally anti-hormone. So so to go back to that story, it's to your point, it's a risk evaluation, a risk assessment, right? So what is life like when you're symptomatic, really symptomatic, and you see a woman who's 38 and is suffering from, tell us the kinds of suffering that she's experiencing, and then what the hormones do to counter the suffering. And then I'll have a more educated opinion that I should have never had to begin with if I'm not educated.
I'll go there in a second, but let me go back to what I said about being individualized, right? So there are a lot of physicians out there putting in these pellets and doing hormones online, and they do standard blood work. You come in, they do A, B, C. They don't understand. I have seen pregnancy tests on 60-year-old women, okay, who haven't had periods for 5 years, okay? Because this is what they're not OBs or they're wherever they are, and this is what they're supposed to do, and they do it every time. They check to make sure they're menopausal with an FSH. Of course, I don't do that. I don't do a I mean, I've seen these results, so it makes me upset because you know that the people they're seeing are just doing we're taught A, B, and C, and that's all they do, and there's no gray, and there's no thought process. Anyway, so symptoms. Probably the most overwhelming symptom for a vast majority of women are the hot flashes. And if you've never really had them, you just can't understand how devastating they are and how life altering. Okay. You don't sleep. You're up 2 or 3 times a night, covers on, covers off. So that leads to sleep deprivation. And sleep deprivation is the worst thing you could possibly do for yourself, right? Hot flashes can feel like you're in an oven burning from the inside out. You don't have to sweat. Okay. It affects you at work. You do a presentation and all of a sudden you know you have this hot flash, or you're talking to your team or whatever or you're on a podcast. The first thing hormones can do for somebody like that is you eliminate the hot flashes, and they feel so much better. That simple thing, getting rid of those hot flashes, is life altering for them. But it's not only life altering for them, it's life altering for the people they live with and the people they work with. Oh, for sure. I always tease my patients. I say, "Where are my flowers from your husband?" Because it has changed the relationship there.
And so what other symptoms would
The hormones, okay. Joint pain, brain fog, just a sense of well-being, dryness. There's some studies that show it's cardioprotective in the early going. So you go on hormone think about it. How many young women do you know have heart attacks? You don't know many 40-year-olds, right? You see 40-year-old men. The number one killer of women postmenopausally is heart disease. It's not breast cancer, it's not anything else, it's heart disease. And that's because the changes within the body, with the lack of estrogen and hormones, changes the blood vessels and the increasing cholesterol and atherosclerosis, and it's heart disease. And there's some studies that do show that early within menopause, starting the hormone replacement, you get some cardioprotective effect. It probably wears off by the time you're 70.
That's a pretty long time though.
Right, but it really is beneficial for people like that. So that's beneficial. Your bones. I saw a patient who's sort of through a friend, and her main problem is osteoporosis, okay? And she's been on hormone replacement because hormone replacement helps prevent bone loss. If you're on medication for bone loss, it helps maintain that bone, okay? And she was on hormone replacement till she got breast cancer. Now, mind you, she's in her she's in her 60s, and she's, again, not gonna die from the breast cancer. She knows that it's not necessarily having anything to do with the hormone replacement, and for her, the bones were such a big deal. So that's something to really think about, and she watched her mother suffer in severe pain for years because you can get spontaneous vertebral fractures. When your spine becomes too weak, it fractures. It's not like a hip that you can replace.
I just had a conversation with my aunt this morning, just before the workday, and my aunt, used to be 5 foot on a good hair day, and now she's probably about 4'8".
Right. Oh, she lost a lot.
Yeah, she is, yeah, but, her problem was she had a complete hysterectomy at 45.
And nobody gave her hormones at 45.
Correct, correct, and she has the worst osteoporosis ever. She's got so much arthritis, she's got so much pain in her back, in her hips, in her everything, and one of the doctors, she's been to every doctor and, for the bones per se, right? And they basically said that she should have been given hormones. She was given hormones for, I think, a year, and that was it. And so they should have, helped her along because she had no native hormones floating around in her body.
Correct. Correct.
It kind of changed my perspective about, the hormones. And I also you mentioned pellets when we had a conversation. And
I hate pellets.
do tell, because I know some people that have them and know them and use them, and I wanna hear the business of pellets from a doctor.
So pellets are money making. Okay, they're expensive to use. And once they're in your body, there's no getting rid of it. There's no control. They always I've heard what they say, and they say, "Oh, the body only takes what you need." That's not how it works. If something's highly concentrated and there's nothing here, they even out. It's not that the body says, "Oh, I only need a little testosterone today," right? I've seen people come in. I have a few pellet stories. And I could have made a ton of money over the years doing it. I mean, easily.
That actually I wanted to put a fine point in that. I wanted to just say your commitment to not selling out for the money is admirable, because there are a lot of doctors that are pushing what they're making money on.
And the thing is, a lot of them are not OB-GYNs. So when they have a complication from the hormones, what do? They send them to their GYN. It would be like me giving you Lipitor for your cholesterol, but when you have a heart attack, go see somebody else. I can give it, right? I'm a physician. I can give it. Doesn't mean I should. It just doesn't mean I should. All right? They're getting on the bandwagon. So, and of course the patients feel better. They have estrogen. Their hot flashes are gone. It's a miracle. Well, we can do that a lot of different ways, right? They have very high testosterone levels. So testosterone's an android. So they feel a little bit more
Energized,
energized. That's a good word. But
if not horny, but
right. And that's the point of it. But testosterone has side effects. You can lose your hair on your head. You can grow hair on, places you don't want to, right? You can become aggressive. You can develop acne, and you can develop voice deepening, which is important for people who sing, because I won't be able to hear the difference, but somebody who has that as part of their repertoire will. And then you can get something called clitoromegaly, which I've seen. The clitoris and the penis are the same organ. Okay. In utero, when the clitoris is exposed to the testosterone, it grows into a penis and forms, the sac and the ovaries are like testicles, right? Right. So what happens to women who have too much testosterone, the clitoris grows, and it actually can stick out between the labia where, I had a patient come in and I said, "Didn't you notice?" And she's like, "Well, yeah, I guess." I had a patient come in with a very high testosterone level. Okay, female testosterone is generally up to about 40. Male starts at 400, right? And I've seen people come in with levels of, and sometimes I'll keep them higher than 40 if they need a little bit more, but I'm not going to make them 100, right? I'm not going to make them 400. I've had people come in 300, 400 from the pellets, and the doctor's response, that gave the pellets is, "Oh, we can give you some other medications to counteract it." So, correct. That's exactly right. So that's why I don't like pellets.
Wow, let's give you more meds to actually counteract the thing that I shouldn't have given you in the first place.
Yes, they're effective. Don't get me wrong. They're very effective.
But they can go out of whack pretty quick.
And what they do is they bring them in every couple of months. They draw the blood. Doesn't matter what the blood shows, they still give them new pellets. I have yet to see somebody say, "Oh, your levels are still okay, so I'm not going to give you anything." It's money making. They're the ones that check your FSH to make sure you're menopausal. They're the ones that do your pregnancy test. I mean, there's no thought process. And I'm generalizing. I'm sure there are good people out there doing it. Okay.
That gives me pause.
Right. So I provide the same drugs. Hormones, right? Estradiol, testosterone, progesterone. I provide the same things, but I provide it in a different form that we can manipulate and change. And if you don't like it, you can stop it. It gets metabolized and So I just saw another patient this past week who was on pellets, and I didn't give her any testosterone the first time I saw her because it was way too high. And now I gave her some starting low because she doesn't need that much, but we can adjust. I can check back in a month or two and make some adjustments and see how she metabolized what she's on.
Right. Your approach to your practice and your medical framework and your philosophy is really quite comprehensive. You talk about mind, body, soul, investing in yourself and as each patient. How do you, how did that happen for you and what is the result of that?
I'm not sure I can give you a specific thing about how it happened. I think it just was, it's just organic. It just happens over time. For instance, we talked about sex, right? Reaching middle age. And I think this is the mind, body, soul thing. So I think what people don't realize is if you think about the animal kingdom, the reason for intercourse was for procreation.
Sure.
Okay. Menopausal women can't procreate. The biological process, that switch is off. And we don't have a single FDA approved drug to turn that switch back on. Just doesn't exist. So now you have to approach it in a variety of different ways, right? And this is the thing that happens. Okay, so there's an old saying, men have sex to relax, women have to relax to have sex.
I love it.
It's true, right? And what people don't realize is think about middle-aged women. They usually have kids. Not you again, generalizations. So
Right.
they generally have kids. So that's one thing. They generally have aging parents. That's another stressor. They work and they have a home and they have a spouse. Okay. So by the end of the day, if you don't have that biological urge, you just want to go to sleep. Has nothing to do with caring or loving your partner. It has nothing to do with him. The biggest problem is the men don't understand that. And so it really becomes an issue between partners. And you have to address it because it can really create a major problem in the relationship because the men take it personally. They believe that they don't want to have sex with them because they don't love them or find them attractive or any of those things. I mean, think about a 22-year-old, right? They ovulate and they are horny when they ovulate. And that's why we get unwanted pregnancies. They, want to have sex because there's the biological urge for it. And they have sex around the time of ovulation. I mean, in the animal kingdom, you don't see, they procreate, but they don't have random sex for enjoyment,
That's a good point.
right? And women aren't supposed, when you're pregnant, every single organ system in your body changes. Your cardiac function, your blood volume, your hematological status, your kidney function, everything changes. And you can, a 30-year-old or 20-year-old or even a 40-year-old can tolerate it. But most 50-year-old bodies can't. And that's why you're not supposed to be pregnant at that time, right? Men don't ever have to do that.
There's so much they don't have to do.
We won't go there. That's not the topic of this conversation.
Your patient walks in and they say all of that. They're like, "I'm too freaking tired." Ah.
So I have that biological conversation. And I said, you have to have a conversation with your husband and you have to be honest and you have to make them understand, or partner, whoever it is, that it isn't personal. It isn't that you don't find them attractive. It isn't that you, you know, don't want to be with them, but sex has taken a different role within your life at the moment. Okay, that's number one. Number two, vaginal dryness and painful intercourse is another very common complaint. If it hurts, you're not going to do it. Period. Right? Here, let me just slam your hand in the car door. Let me do that over and over and over. Right? It's not going to happen. So there are ways to address that, and everybody is different. Okay. And people don't understand the concept of vaginismus. So, if you're going to get hit by something, you tense up because you're anticipating the pain.
Yes.
Well, that's what happens during menopause and postmenopause, that you anticipate the pain. Not everybody, again. You anticipate the pain, the muscles spasm, and it hurts more.
Oh, great.
Right. So oftentimes it's not just the dryness, but it's the consequences of the dryness. Okay. And you're on a hamster wheel. It hurts. You anticipate pain. It hurts more. And you can't get off of it. So you have to get them off the hamster wheel. And that has to be explained to the partner. The conversation is very important. And I think that's where that mind, body, soul type of thing happens. And then, you have to offer what you can offer. And it works for some people. It doesn't work for everybody, And then, I'm sure you have plenty of middle-aged friends that have become divorced. And they'll come in and say, well, I just don't like my husband anymore. Well, it doesn't matter what I give them. I can't make them like their husband.
Right.
Right?
That's hard. Yeah.
That's hard.
There's a distinction between not liking and wanting to be with someone and not feeling it because you're not feeling it, literally feeling it. It's the point of what you were making before. The distinction you made is it's not that I don't want to be with you or be with you. It's not really appealing right now because it hurts.
Right. Or biologically, you don't have the urge, right? The urge is just not there. There are 80-year-old men fathering children, right? These are all part of the menopause. We're not miracle workers. We do our best. We can't eliminate everything. I can't eliminate your aging parents. I can't eliminate your child with, maybe some learning disabilities, or even just a normal child, with no learning disabilities. That is a stressor, right? They're applying for colleges. You need the finances. And so I also try to manage expectations, because they come in sometimes expecting everything to be completely better and improved. And we can't get rid of life.
Yeah, you have to also create some coping mechanisms and some other, what we'll call, life balancing practices that allow you to get through.
And women put themselves last.
Oh, I'm finding that out with my retreat girlfriend. Oh my God.
Women put themselves last, always, every single time. So you have to convince them to start doing some things for themselves.
I always say, I don't know if you use this, but you got to put your oxygen mask on first. Put your oxygen mask on first, girlfriend. You're useless if you are out of air. How are you going to put Junior's mask on? How are you going to put Senior's mask on? How are you going to help the family if you have no freaking oxygen? That's one. And second, you can't pour from an empty vessel. You cannot pour from an empty pitcher. If you've got no water in it, you ain't got nothing.
And if it's only half full, then when you do pour, there's nothing left.
Are we pretty, complete on the menopausal? Because I was going to go, what are you hearing most? Frequently heard FAQs from the young to the middle to the older. What are you hearing most from women these days?
One of the biggest things is their weight. That's a huge thing. And that's where managing expectations really comes into play. So our basal metabolic rate declines every year of our life. So when you were 25 and you didn't eat for 2 days and you lost 8 pounds, it's not going to happen, right? It's not going to happen. And your expectation that you're going to weigh what you weighed at 22 is probably not going to happen, right? I think one of the biggest things that I guess I've learned over the years is it a lot of it depends on attitude as we age, right? People cry their eyes out when their kids go to, kindergarten, and they don't want them to go to college. And it's how you address those age changes as we age, right? So for me, I was thrilled when my kids went to college because I had a great time at college and I wanted the same for them. And if you have, people say, you know, I hate aging. And I say to them, well, the alternative is worse. So you need to embrace, it's true. Either, they talk about menopause. I say you have a choice. Every woman goes through menopause or you're dead. There's just no in between. And you can embrace being aging and each stage of life and the different relationships that you have with your kids when they're young, or your spouse or your job, or who you are at work. You can either embrace it or you have a negative thought process, and it's just not healthy. I'm going to go back to my mother, and somebody once said to me, your mother will always go out. I said, right. I'll ask mom and we'll go out. And my mother didn't like going through to early bird specials because there was only old people there. She wanted to go out when young people were out and around. She wanted to go out to dinner anytime or do anything. So her attitude was to continue to live and enjoy each stage.
Yeah, I mean, again, this is not something that going to your office is going to solve for. If you're a negative Nelly and you see the glass is half empty, there's no amount of Dr. Cindy Parnes, loving embrace that's going to change the fact that you might be negative.
Right. I'm pretty straightforward about it. And you you have to wake up, like people say, wake up and be happy that, you're still breathing and above the earth, and, enjoy each stage that you have to go through. I mean, there are things that, are not fun about aging, but you're still here. You're still participating.
Yeah. So, what do you think holds women back from going to see a doctor about their fill in the blanks, hot flashes and sexual, you know, issues or whatever?
Yeah, so women who are heavy don't like to go into the doctor. Well, because they don't wanna get on a scale. They're not comfortable in their body. They're afraid the doctor's gonna say something about their weight that not in a nice way. There are things we can say, right? In a professional way that is not derogatory or denigrating, right? But that's one of the biggest things. I mean, I purposely, to be honest, have large gowns. So, because one of the worst things is if you have a heavy-set woman that has to get naked and the gown doesn't fit.
Oh my god, I never thought of that.
Of course not. Well, but that's not for you to think of, that's for me to think of. So that's one of them. That weight is definitely one of those things. I'm gonna say that the new medications have made a change because people feel like they can get some help. Not everybody's willing to do it, but a lot of people are. So that's one thing. 2 is, there are people that are very private and they don't wanna discuss their sex life. They don't wanna discuss their vagina. You know, they don't. They're afraid like you are. They're misinformed and afraid that of hormones, and they don't realize how much better they can be.
Right, well, I was lucky in the sense that I wasn't, what do you call it, symptomatic, right? So, I would have like a warm feeling, super warm feeling every once in a blue moon. That's not your target person.
Well, but you would have benefited from other benefits of the hormones
Right, I personally went on, I went on the homeopathic, cream topical cream.
that you got where.
No, 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 my doctor did it. My doctor compounded it.
Okay, so there's no difference.
I don't know. What do you mean?
I'm gonna give you one of my pet peeves.
Go ahead.
The word natural. No, I'm not saying you, but people come in all the time saying it's natural. And my answer is look up the word natural in Roget's thesaurus and see where it says safe as a synonym, effective as a synonym. It means nothing. But anyway, so if you have a cream that's compounded that has estradiol in it, right? and I give you a pharmaceutical grade estradiol, what's the difference?
Probably the pharmaceutical grade is gonna be better. I have no idea.
There is no difference, right? And there, I do it all, right? I'll give pharmaceutical grades, I'll give compounded medications. Testosterone has to be compounded. It's not available otherwise. Sometimes there's three types of there's actually four, but there's different types of estrogens. Estradiol is the main one that your ovary makes. Then there's estrone and estriol. And sometimes estriol works better for the vagina. So sometimes I'll use that in the vaginal creams to help with the dryness, but that has to be compounded. I mean, there are things that I compound. And again, I make it individualized.
Right, that's what I love about the notion of compounding. You guys meaning the doctor has control, right?
Right. But we have control, like, so estradiol, for instance, comes in a patch, which is using estradiol on the skin is much safer than taking it orally. That patch comes in 5 or 6 different doses. 0.025, 0.0375, 0.05, 0.075, point 0.1, 1.25. Right. So you
Yeah.
can control a lot of it. And for some people, the costs of the compounding creams is too expensive for those that can have insurance coverage. Right? So, you have to be willing to do whatever, and then I have other people that have done their research and they're more comfortable with the compounded, and I'm fine with that. And I will do it, and I'll monitor it, okay? So, that's what I mean by individualized.
That's awesome. That's really awesome. So I have a couple questions. We'll blow through these because I'm realizing, wow, we've been having so much fun. So, what's the best career advice you've ever been given?
I knew you were gonna ask that, and I have to tell you, I didn't really get any, and I'll tell you why. I grew up so neither of my parents, were college educated. My father was orphaned at 13. My mother, they were married, my mother was a teenager, okay? My father was a ward of the court and needed permission, but education was stressed, okay? My father was probably one of the smartest men I knew, okay? And my daughter said to me, "Didn't you feel anything about being with men?" And I really didn't. I never looked at myself being treated differently, and maybe it's because I was competitive with my older brother, and I had a phenomenal relationship with my father, okay? And so I really didn't. And then I went to school, and I wanted to be a doctor, and I went to medical school, and, you know, could back then I'm not so sure that there was this career advice like there is now available.
So, what career advice would the best career advice you give to other women?
So this is one of the things that I say to young women having babies, and this is career advice I gave. Keep your hand in it. We all want to be home to take care of our kids, and I understand that. But we don't know what life brings. And when you stop working completely, and 20 years from now, you have a different life circumstance and you need to get back into the workforce. Your skills are useless, they're outdated. If you can maintain some sort of balance between having your hand in your business, and especially now you can work from home, right? And as well as child rearing and everything else, that would be my best career advice is to keep your hand. Why do you think we have so many middle-aged female realtors? Because they stopped working. They all think they can sell a home because they've all lived in a home, they've all decorated homes, and so they can take this short course and they become a s a realtor, and, it's but the skills that they had younger are gone.
So true. So, if you had a chance to speak with your 30-year-old self, your 30-year-old Cindy Parnes, doctor at the time, I'm sure, what would you tell her?
I'm not sure. There's some decisions that I made in my life that in retrospect, 2020 hindsight, maybe I would have done differently. I mean, I loved what I do and I love what I do, but there's a part of me that misses the academics right? So I left academics because once you go into private practice, you just don't do that. Maybe I would have combined academics and private practice. Who knew I was gonna feel that way?
Yeah. I mean, what you're describing is the open yourself to possibilities, right? So maybe the answer is more like could have, or I would have encouraged myself to leave doors open. Or, what's funny? When I ask this question of all my women leaders, 90% of them say one version or another of the following statement: "You're going to be fine. It's gonna be okay. It's going to be okay." And that's what they want to tell their 30-year-old, because when we're 30, we are running around trying to make it all happen, juggling a million balls in the air, hoping none of them drops, and just praying we can get through the day.
But I'm gonna say one thing that's different now. We had no internet, and I think the internet is a game changer, okay? You and I, we applied for jobs, and we competed with the people that read the same newspaper, okay? So, the internet is good and bad, okay? It allows people to work from home and have a hybrid lifestyle, but the level of competition, the amount of information that's available is almost too overwhelming. I mean, you see people going down rabbit holes.
Yeah, especially in your business, they self-diagnose. They go on the internet, they're like, "I have, fibromyalgia coupled with some, like."
Yeah, I tell them Googling on the toilet doesn't make you a doctor, right?
Guys, if you haven't found this episode entertaining, then you need to check yourself for a sense of humor. And certainly you've learned something. I want you to share this episode with somebody that you know might benefit from Dr. Cindy Parnes' advice and insights and practice. I invite you to leave us a rating, to share this, and for God's sake, click on the subscribe button. I know all of you are watching it and listening and you're not subscribing. So let's just do that. It does absolutely nothing other than to let you know that new episodes are available. You don't want to miss guests like this. Thank you so much. Make it a great day. Bye bye. Thank you so much for listening to Possibilities with Monique de Maio, where we unpack life as a female mover and shaker. If you like the show, please consider liking it, or better still, subscribing to it and leaving us a rating. It truly does help. Also, you can pick up my book, The 7 Secrets to Creating a Life You Love, a practical guide for women in leadership. You can find the book, other episodes of this podcast, and how to stay in touch at moniquedemaio.com. DEMAIO. I look forward to seeing you again soon. With gratitude, Monique.